To start our first lecture in this series, it will be given by Dr. Cynthia Stonnington, who is the chair of psychiatry at Mayo Clinic, Scottsdale. She is going to speak to the issue of pearls to help all of us treat and empower women who have both somatic symptoms and true depression. So please help me welcome Dr. Stonnington.
Thank you very much. So, I'd like you to first take a moment, close your eyes. Imagine you're back in clinic, got a busy day, and you are about to see a patient in follow-up who you've obviously seen before, who's suffering from multiple chronic, distressing physical symptoms. They're impacting her quality of life and ability to function. She's pretty frustrated that you haven't given her an adequate diagnosis, much less fixed her symptoms. All right, sorry, I should have probably given you a trigger warning. But okay, so we'll fix this. Just take a deep breath. Breathe into the count of 4. That's it. And then out slowly to the count of 8. All right. We're gonna help you with this patient. So my goal is for by the end of this talk, you will feel a little bit more comfortable in working with some of these very difficult patients, as well as maybe experiencing a little less distress as you go about doing it. So I don't have anything to disclose. So we're going to discuss factors that are associated with often creating a distrust of medical professions, feelings of invalidation that a lot of patients experience. Talk a little bit about the role of early adverse events and effects on attachment systems, stress, and mood. And then spend some time talking about some strategies that may help you focus your interventions on function over symptoms and increasing self-efficacy and empowerment. So a lot of times patients will tell you, when they're having a lot of chronic distressing physical symptoms, a lot of times doctors will say, well, it's because you're depressed, and we just need to treat your depression. And they'll say, I'm depressed because I have all of these symptoms. And to some extent, your patients are correct. I mean, certainly, the more you have, the more number of symptoms that you have, the more likely you're going to be experiencing depression. It's very important to treat the depression.